Fertility treatments offer women more options than ever before to become mothers, but science too has its limits. A woman's age can impact her chances to conceive, even with the latest fertility treatment technology. And joining us now is fertility specialist Dr. Isabelle Ryan of the Pacific Fertility Center in San Francisco. Thank you so much for being here to talk with us about this today. Let me first start off by saying I have many girlfriends who put their careers first. They wanted to travel. They thought that there was plenty of time to start a family. You say not really the case, that time does catch up with you.
Time does catch up with you, absolutely. And this is actually a very common scenario that we see where you know, women or couples come in and they've made these decisions in terms of their careers, and the average age of our patients in terms of female patients is 38, and definitely at this point we're starting to face some challenges in terms of the biological clock and looking at the reality of making decisions about, you know, when they want to start their family and how they want to create their family. And even nowadays we talk about how many children do you want, and how do we then position you for success in terms of that particular, you know, sort of project at that point.
So you mentioned 38 as the average age. Let's talk about age here for a moment, because what starts happening at 38, 40?
Sure. Well, what happens is we as women are born with all the eggs that we will ever have. So we do not get to create new eggs along the way. So very different biology than what happens for men and testicles that are constantly creating new sperm. So egg health maintains until about age 33, 34, a little bit of a decline at 35.
Yeah, and that's what we're seeing right here on the screen for the viewers now.
Okay. And much more important decline at 37, and very important decline by age 40. So if the average age of our patients is 38, they're coming to us right during that steeper decline part of what's happening for their eggs, and it becomes more challenging for us to then, you know, be able to help. So we need to get in there and make some quick decisions about what that particular patient wants to do.
That's what I was going to say. It may be a decline, but it's not over. No. When you do, though, look at a woman, what is some of the criteria to make her a good candidate, if you will?
Sure. So we'll ask her to do some hormone testing so that we can look and get further assessment in terms of what is her current egg quality based on her hormones. We'll do an ultrasound, look at the ovaries, look at the uterus. The uterus is very important in terms of having a nice environment that we can potentially transfer an embryo into. Of course, there's the sperm, looking at sperm quality that contributes as well to the health of an embryo. So those are the main three pieces that we look at. We'll talk about other things like, you know, general health and supplements and things like that. But assessing the uterus, the sperm, and the eggs are the three most important pieces.
Yeah, and it's not inexpensive to do this, and a lot of times it's not covered by most insurers. So your advice to women out there if they're looking to go down this path?
I think the most important thing is to really be well informed and understand your options, because you want, or I want my patients to really understand what the associated success rates are with different kinds of treatment, and to really make an informed decision, and even to think about, again, how many children does she want, or how many children does the couple want? Because if you come to me at 38 and say, I really would like to have 2 kids, then you probably need to be fairly proactive in your treatment choice.
Sure.
If you're somebody who says, well, you know, I'd be happy with 1, then there may be a little more time.
It was funny, though, last little comment here, when we were getting ready for the show, I was telling you about some of my girlfriends, and your comment was, freeze your eggs.
Yes.
So that was your advice. Doctor, very enlightening. Thank you so much for being here today.
Thank you.